So make sure everyone's on the same page with kind of what's happening with our dietary guidelines. They've been around for quite a while, and they get updated every 5 years. And as dietitians and health professionals, this is our go-to, our backbone for a lot of the programming and education that we do. Because this is what our government is telling us. This is what people should be eating about every day to be living healthy lives, so to speak. And so for a lot of us that have been in practice for 10 plus years, even if you've been in practice for the last couple of years, when you were in school, you were learning the old DGA's way, as we call it. And so a lot of us are used to the things that are listed on here. So I have a then and now handout for you. And so we've always known that there's been this focus on food groups and eating certain things within the food groups at certain in certain quantities. And then when it came to the other stuff, like sugar, we had limits on these things. And to make sure that we were educating individuals that this stuff was in it, not to be overdone, because it was in addition to what they were supposed to be eating every day. We were simply trying to get folks to eat fruits and vegetables. Just get them to eat fruits and vegetables. And if we were successful in that, get some variety in there. Some color variety, some varying of fiber levels, things of that nature. And then over time, the DGAs have grown or did grow with the American people, in that back in the day we said the meat group, and then it transformed into the protein group because we were now recognizing non-animal sources of protein. And so we were making great strides with now having education where we could bring in tofu and all the things so that people felt connected to it and resonated with it and could put it in their daily lives. Same thing with the dairy group. We used to think the milk group. When I was a little kid, it was the milk group. Gotta drink your milk every day. That's not practical for most of us. And so we have our dairy group. It's focused on calcium, and now we have these options: almond beverage, I'll be politically correct, soy beverage, all of these things that are alternatives and substitutes for those that need them, that have been modified to equate to the calcium levels of milk products. And so our whole grains, it was always half of our grains should be whole grains throughout the day. And what's made that a lot easier is a lot of products are kind of pushing that. And so a lot of people don't have to think about that if they eat cereal every day, if they have bread sandwich every day. So the way we've been manufacturing food has helped with the DGAs, with helping folks get along the way. And then one last note with dairy, we've always kind of over time focused on dairy that was less and less fat. So if I remember back when we were little ones, where it was like you got school lunch, you got whole milk. And then remember hearing about I'm the oldest person in this room. I just realized that. And my students, no, I'm older than you.
No, you're not.
I'll talk later. I'm the oldest person. I'm the oldest person. But we only had whole milk. And then I remember in high school being like, oh, you got 1%? What's that about? Like, you got milk options? You got chocolate milk, strawberry, what? Like, I didn't know, we didn't have those options. And so the DGAs were, hey, if you're drinking your milk, it doesn't have to be that whole full fat. Like, all that fat in that drink is not necessary, because you're going to be getting your fat from other sources throughout the day. And so how things have changed this year. So in January of 2026, which was a whole year behind schedule. So usually in January of either it was 2020, it should have been January of 2025. The new DGAs should have come out, but we didn't get them until a whole year later. And when they came out, they're completely different, because they were brought to us in a whole new package. And so we had My Plate before as an educational tool to show individuals and be like, hey, You can get your plate to look a certain way. About every meal, every day, should be hitting the sweet spot. And now we have an upside down triangle, which is very triggering to anyone of my age, not Catherine's. Of when we had the food triangle before. And we're like, wait, now it's upside down? And everything's out of order? No. So it's very triggering, it's weird. And it's hard for our brains to wrap around. So what's different now is that the messaging that is coming out with the TGAs is more about these sub-messages within the big message. So TGAs was always like, we just want you to eat healthy, and hopefully this will help reduce risk for disease. And we want you to start early in life, so it creates habits throughout your life and creates a lifestyle. And now it's like, you must eat this way. You must eat this way or you will die. And it's like, oh, that's a little strong, a little weird. And so the guidance has shifted to where we went from being told X number of grams of protein a day to being told to calculate our own protein needs. So I'll let our panel talk about that, but like the only people that are qualified to calculate protein needs are the RDs in this room and any RD that's out there. So when you start to get to the 1.2 grams per stop, I don't want an average person doing that. That scares me. And so that's math that I learned in a college class I paid for. That's when it starts to get too complicated for the average person. There's a strong push with the whole grains for everything to be whole grains, high fiber, as much as possible. Try to reduce refined as much as possible, which is kind of impossible if you think about our food structure in our country. Big pushes on full fat dairy, high fat dairy, butter, high fat, red meat. Things that we normally in the past were telling people to limit or avoid. So there's been this little bit of a switch in the messaging, which is confusing to some people in practice. Because when the messaging before with limiting or avoiding was to help reduce disease. And now we're telling people it's okay to eat, and so there's a little bit of confusion between consumer and practitioner. And so those food groups are still there. It's just there's not as much focus on them like there used to be. It's more stay away from ultra-processed foods. Stay away from this, but eat lots of this other stuff. And they cherry pick within the groups what they really want you to focus on. And so they make it a positive thing is that this new document is more consumer facing, but it's lost a lot of the science behind it in that it went from being an 85-page document to a 10-page document. And that might be fine for the general public, but is that the most appropriate for a researcher practitioner who wants to see where the information originated from? And so those are the differences that we haven't seen a version for health professionals that might have more pages to it and more information. And so what I want to do is not so much focus on what I just said. I just want to kind of put that out there, but focus on where we're going with these guidelines because yes, we know we have them through 2030 and we don't know what's going to happen with our political structure and who's going to be in charge of what in years to come. And we could have an entirely different leadership in the Department of Health and Human Services, but they may choose to continue this. And so we have to start wrapping our brains as practitioners around how we're going to give this message to the public in a way that we feel is appropriate for our audience and the type of work that we're doing. And so I brought a panel of all of my alumni are my favorites, but the ones that say yes are my ultra favorites. And so Nick could not be here tonight. Nick had a little puppy dog emergency, but I have his information. I'm going to send out his a little info on him if he wanted to share his email with y'all. He is the RD that's at Red Stick Farmers Market. And so hopefully we can get him to come for a talk another time. But We will be without Nick this evening, but I'm going to go down the line and I'm just going to have our panel just quickly introduce themselves.
My name's Cassie. Word. Okay. That's it, I'm Cassie. That's why I did that. I am working for the Backers Diocese Child Nutrition Program. I'm currently helping create all the menus according to the National School Lunch and Breakfast Dietary Guidelines. I say dietary guidelines because as a federal program, those directly mirror those federal dietary guidelines. So our meal components, nutrition guidelines also mirror that. So I'm working directly with the federal pipeline of nutrition advice. So that's where my job is evolving, especially with all of the new policy coming out, and I'm interested to discuss that tonight.
Hey everybody, my name is Catherine Baque. I am a two-time graduate of LSU. I graduated from the Dietetics program back in 2008, show my age, and I came back and graduated with my PhD in human nutrition in 2021. My current role right now, I am the program director and associate professor at Franciscan Missionaries of Our Lady University, and so I oversee the graduate program in nutrition and dietetics over there. And so my primary role is in education and educating students. And I do some research on the side. Well, as part of my job, my main job responsibility is teaching and administration. But then I also hold a clinical practice day where I work inpatient at Our Lady of the Lake in the hospital, where I see patients ranging anywhere from ICU patients all the way to rehab patients. So I still have an inpatient clinical piece that I do. So I'm really excited to have this discussion with you guys tonight.
So my name is Sydney Darby. I work outpatient at Baton Rouge General. So I'm mainly see bariatric surgery patients before and after surgery. So a lot is educated on, what surgery looks like after, well, the diet looks like after surgery, and also going over like pre and post-op diet. So I do see a lot of other patients as well, a lot of diabetes, heart health, renal, but my day-to-day looks like counseling, one-to-one, teaching some classes as well, pre-op classes, and a lot of community events as well.
And both Sydney and Cassie are also Fran U alumni, so it's a double alumni celebration. All right, so Cassie already touched on this a little bit, but I would love for each of you to give an example of how the newest DGAs has either directly or indirectly affected your work and any challenge that has arisen or that you see on the horizon that you're concerned about.
Right. So like I was saying, as a federal program, the National School Lunch Breakfast, we also have adult child care program after school. We have the CEP program. So all of these federal programs are also guided by the state legislation as well. I've had to kind of adapt to not only federal, but also state, especially this last legislative session with the brain fragments, with the laws that have come out with the food dyes, food additives that has been targeted towards school nutrition. School nutrition is very political. Tax dollars are going to this program. Everyone's invested. Children, maybe not so much. They just kind of want to eat, but especially parents and industry and as you can see, like industry politics that definitely mirrors the dietary guidelines, especially in this day and age. So recently they just came out with the Whole Milk Act. So you talk about whole milk. That specifically is directly affecting me because that was passed right when the DJs came out, and that needs to go into place as of, it could be as of this school year, but definitely the start of August. So that makes us need to kind of pivot and include that into our bid as we need to go through those proper pipelines of federal guidelines and state guidelines, but also in like the ultra processed foods, because with the state laws, not only federal, those recommendations, but state laws now, we can't have ultra processed foods in our school nutrition. But how do you define that? There really is no definition of that. I think like Harvard has done a good job of trying to define it, but take a sandwich, for example, like that's one of the most processed things you can eat. Your bread, your deli meat, your cheese. But that's like one of the main things that children eat day to day. So where do you draw the line? Do you have to say, oh, this item that has red dye or it has BHA in it that's processed, you have to cut it. We're kind of already going through that. And that was part of my job during last legislative session to go through all of our current items that we have in our program to see if we were even in compliance with that. But things that you wouldn't even think of, that like mustard has dye in it, pickles have dye in it, the no, literally things that you wouldn't even think of. And like our mashed potatoes and maybe potato flakes, all of those have BHA or BHT in it because it's a preservative. It's a whole food that's being dried, shredded, and preserved for you to cook at a very convenient pace. So that was a really big disconnect from industry to legislation to our school nutrition. And between the milk and the ultra processed, that might be a really big impact as of right now. I will say what is coming down from when they do adapt the nutrition guidelines for the program is the MMAs. And I say MMA, that's the meat alternates, the proteins that we have to offer each day. So right now it's mirroring towards our previous guidelines where it was a certain amount of grams per age group. You know, you can increase your protein as you get older. So our lower grades get 1 MMA and our high schoolers, they get 2 MMA as a minimum per day. But with the increase in protein, what is the most expensive MMA or food group on your plate? The meat. So it's like, how are we going to pay for that? And we'll talk about that later. But yes, so it's all coming full circle, and it's just things that we talk about in our space. You know, having guidance from industry is definitely so important before making those political decisions. So we'll talk about that. Mm-hmm.
So I think, Cassie, your job is probably affected the most out of all three of us, I would say. But as an educator, you know, my role and responsibility is to educate our students on, you know, what's new in research, the guidelines that are coming out. Not only do I teach in the graduate program, but I also teach, of course, in our undergraduate pathway that we developed this past fall's nutrition assessment. And in that course, we talk a lot about like where the assessment guidelines come from, and they date back basically to the dietary guidelines for Americans. And so we're not teaching it this semester, but I'm having to kind of revamp that course for the summer and the fall because we have to figure out a way on, you know, just like Dr. McKinley was saying, like how do we feel comfortable educating our students on these new guidelines when we perhaps have a different opinion about it, or we as scientists and nutritionists, we, you know, have that research foundation and we know where to go for that evidence-based research, but these policies and these guidelines that are coming out are contradicting that. And so it's really difficult as an educator to navigate that because in my opinion, I don't want to really boast my opinions on our students. I want our students to form their own opinions, right? But my job, I think my responsibility as an educator is to really show our students like where to go to get that information. When the dietary guidelines first came out, and I'll be the first one to admit, they came out and I immediately knew about the dietary guidelines because I saw on Facebook that people were commenting about it and people were having like a very knee-jerk reaction and opinion and blasting it all over social media. And I like immediately went into a rabbit hole and I was like, okay, let me go down this rabbit hole. But I was like, wait, I have to take a step back because first of all, I haven't even read them myself. And second of all, I want to form my own opinion about it. And it's really important for me to form my own opinion about it so I can help my students form their own opinion about it. And so what I did and kind of how it like changed, I think the question was how has it impacted you and what challenges do you face? So right now, I think I was talking to Emily about this earlier, like the last 3 months since the dietary guidelines came out, I learned more about the dietary guidelines than I ever had because I wanted to do my own research, like where do these dietary guidelines come from? What is the rigorous process that these committees take to review the thousands and thousands of research studies that have come out over the last 5 years and make these recommendations? And then why are the new recommendations so vastly different than the previous recommendations? And what did that process look like? And in the middle of that process, we had a change in administration. And that's where the policies and the politics come into play. And so I listened to, I did my own research. And so I stopped going on social media and stopped going through all these rabbit holes. And I started really listening to people in organizations that I trusted and who were reliable and credible. I went to the Harvard School of Public Health is a great organization that has their own recommendations on what a healthy plate should look like. I listened to researchers who were on the original dietary guidelines for Americans Committee, a researcher out of Stanford. I wanted to hear his opinion. I listened to a Joe Rogan podcast with RFK because I wanted to hear what he had to say about it, and so and that's what I try to also kind of show my students too, like there are a variety of resources where we can pull from, but it's important that you know where to go to get the correct information, but then form your own opinion but make sure it's grounded in evidence. You know what I mean? So that's kind of where I'm at right now. I'm still trying to wrap my head around how I'm going to really educate the students about it, and how we're going to change the curriculum. We've changed it a little bit already, but and we've had some assignments that I've put in place already. But that's kind of where I'm at and kind of the challenges that I'm experiencing right now. As far as the inpatient side at the hospital, we haven't seen many challenges yet, but I do foresee them coming in the future in terms of specifically, like, we have to remember the dietary guidelines for Americans are for healthy adults. And inpatient hospital, they're mostly not healthy. And so, they're on some type of diabetic diet, renal diet, cardiac diet. That's not what the dietary guidelines are for. They're for people on a regular diet who are healthy. So I don't foresee it changing a whole lot on the inpatient side, but they were concerned about the protein.
Right.
So more to come on that, perhaps. We'll see where it takes it.
I do have a comment about you saying the dietary guidelines. Before these new ones came out, your average person was not looking at the dietary guidelines. They did not care.
It was actually 164 pages. If it's not
Oh yeah, yes. They did not give a hoot. They're eating Taco Bell. It's just very political these days, and they all want to have an opinion, like you're saying. So, but now a challenge that y'all are going to face as you enter the profession is trying to communicate that and as evidence-based as like whatever Mark's trying to tell you and what you'll learn in your internship is to how to communicate to your patients or to people that you're educating. So yeah.
And I will let Cindy talk. I do have one comment on that. Also, I wanted to say this, something that I like since the whole MAHA movement came about, Make America Healthy Again, and you touched on the legislative bills last year. I think it's our responsibility as a profession to advocate for the profession. You know what I mean? Like, it's so important to advocate for the profession. And if you see these bills that are coming through that make you go, I don't know about that. We are the ones that our legislators need to hear from, because they're hearing from a lot of people who may not be as credible as we are as a nutrition profession. So I actually have been, I was always involved in advocacy and public policy, but over the last year, I have become more involved in it. So I'll just say that too.
Well, with my role in outpatient, since it was a lot of counseling, a lot has changed, mostly with the messages that I relate to patients. So just like the different changes, like for instance, the added sugar. Now for kids, it's, 0 added sugar, which is very hard to, accomplish, especially for children. So just trying to figure out like how to navigate that with patients, or patients' families. And then also as far as like the fats, so kind of confused there, but they now promote the red meat, the different saturated fats, but it also says to eat a diet low in saturated fats. So I'm trying to figure that out, how I want to relay that to patients, but also a lot of our counseling materials have changed. So creating different materials to kind of match what they have. I mean, but still have practical information on there. So that's another struggle, is just trying to take the guidelines and make them practical for most patients. In a realistic situation, they may not be able to choose some of those things in the guidelines. So just having to pick different options to help them out with, whatever is best for their health.
So I have a little guide, but I want to I don't want to go too off script because I kind of prepped them. So I'm going to go with, I'm going to change it up just slightly, just so it sounds more interesting. So taking the national recommendations as they are now, your dream scenario of turning them into feasible real world for your dog. Like, no rules.
No GAs.
You still gotta do GGAs,
Yeah.
but ideally, if you didn't have to answer
Yeah.
to somebody, like how would you ideally want to put them into place that it would work the best for your position? Based off of what they are now, like what we have to work with, what would you do?
Eat kids. Even now, okay, the National School Lunch, those nutrition guidelines, those DJs came out, and then it took years for them to formulate those nutrition guidelines. I also expect it to take years for them to modify these nutrition guidelines off of these updated ones from the federal government, but they're restrictive. It's recommended to have your subgroups of different types of vegetables, certain amounts of fruits, certain amounts of grains. Our requirements are actually 80% whole grain throughout the week, not just 50%. So meeting those guidelines, the saturated fat, the trans fat, the added sugar, the calories, the sodium, it's very restrictive as of right now. And I think these CGAs, they're going more towards just watch out for it instead of having strict numbers. So that may also be represented in the updated ones coming if, again, like the next presidential cabinet wants to keep those guidelines. But in best case scenario, I think kind of loosening some of those strict like subgroups and having a balanced my plate, having we offer all the 5 groups, still continuing to offer all the 5 groups, not being too nervous about not serving a certain amount of carrots each week, or not having the 3/4 cup of other vegetable added to their plates. That can kind of get kind of daunting, especially if you don't understand which of those vegetables are which. So I think that might be a positive thing coming from these DGAs, is loosening up those guidelines. But again, those were set in order to ensure that students across America were getting the micronutrients and the macronutrients that they need throughout the week.
So I think as far as educating students, we can really do like a critical analysis of these guidelines and have assignments on, okay, how can we realistically put these into practice? Like, let's do an analysis and see if it's realistic. So like, for example, one of the criticisms of the guidelines is that the dairy went from recommending low-fat dairy to full-fat dairy. And also highlighting beef tallow and butter as good sources of fat. But then one thing that they didn't change from the previous guidelines, which is a good thing, is that the total calories from saturated fat still needed to be below 10%. And so, okay, how are we going to meet the less than 10% saturated fat from our calories if we're now incorporating high fat dairy, butter, and beef tallow that we know are traditionally high in saturated fats? And so I think like giving students assignments on, okay, let's analyze this to see, like, when we go out and we work with children, we work with patients, how are we realistically delivering this message? Another kind of I'll take on this is that I'm a clinician too. I've been working in the hospital, for 16 years, but working at Our Lady of the Lake is essentially the state hospital. And so we have a lot of uninsured, underinsured, very high food security people or patients that we care for at Our Lady of the Lake, and just within our community. I'm sure y'all see it too. And so realistically, how are we incorporating these guidelines when we know that our patients are already food insecure? And now we're telling them to eat more protein, but protein is expensive, and what does that look like? And how are we, ensuring that they are meeting the guidelines that the federal government has advised us to follow, but then based on the resources that are available to them, is that a practical thing? And so, I think we really just have to take everything into consideration depending on the population that we're serving.
It might be in a reverse by doing the plant-based protein to meet the protein and to reduce the saturated fat. So,
Say that again?
I said it might be in a reverse.
Yeah.
To recommend the plant-based protein instead of the meat-based to meet that protein and less saturated fat. Yeah.
Yeah. But part of like my advocacy that I've been doing is to highlight the food insecure population and the children who are at poverty risk or risk of malnutrition. And like Cassie was saying, like, the child nutrition program is so restrictive already, and then you're adding all these other restrictions on top of it. Like the bill that passed last legislative session, banned dyes, as she was saying. It made restrictions on vending machines.
Right.
It made restrictions on added sugars.
Not only added sugars,
Or sugar sweeteners.
sugar sweeteners.
Sugar alternatives. And so it's like, wait, what if my child had type 1 diabetes and wanted a sugar-free popsicle? They could not enjoy that sugar-free popsicle with their fellow classmate because the state decided to ban a sugar-free popsicle because it had a sugar substitute in it. You know what I mean? So those types of things. And I think it's our responsibility to advocate for that population that is so prevalent specifically in our community.
Right.
We're kind of sheltered in our little bubble here at LSU, I'll tell you that. But when you go out and you start seeing patients, and especially, working with through Our Lady of the Lake, we really see the people in our community who are affected by these changes. Right. Not always in a good way.
Yeah, and I agree with Catherine. I do see patients every day. I see patients from all walks of life, all backgrounds, different situations. So when I am educating a lot of it, they will tell me like, I can't afford this, that's too expensive, like the product you showed me is too expensive, and so this is kind of coming on top of that, now trying to find different options that are more affordable for my patients. So, the message is just trying to figure out how to go with the minimally processed message, but also affordable for a lot of patients. So, yes.
I don't want to break for a second and go and see if anybody has a question in the audience that they would love to throw to our panel. Amanda.
It's for Cassie. with the restrictions of happening and obviously things becoming more expensive and also a lack of access to some of these products because now you just can't use what's available. Do you think that suppliers are going to start shifting what they have available? Or do you think this is going to be something where it may not be till years where this kind of evens itself out?
Right, that was a very big concern last legislative session where this was coming out. Because during COVID, now I wasn't employed in nutrition when COVID was happening, I was a student at LSU, but based off what my director has been able to fill me in, manufacturers were prioritizing the high money making foods, which typically sometimes most likely is not K through 12. So K through 12 is an entire different market in itself. You know, if you look up General Mills and type in K through 12, it's a different website, it's different items, different ingredients, and different formulations. So that was a really big part of our advocacy last session was that it is going to take time for manufacturers to adapt to these changes. Now, I think part of that with the food dyes and the preservatives and everything like that, basically all the states were passing stuff last session. I think 25 out of the 50 were passing things and over 90 bills were introduced. So it was a very big hot topic, very heated topic last session. And, you know, part of our job, like Dr. Rapake was talking about, we were meeting with the senators who were trying to pass these bills to be like, we need time. So we were able to postpone because they wanted it like this school year. And this was last year. So we were like, give us till 2027, 2028. And they were able to amend that luckily. But yes, that was our big message. It's like, we have to wait for manufacturers to adapt. And they expect us to adapt, but you're not going to find all of these alternatives in the store. You know, like that's going to take a couple of years too, probably as well. But they had to force K through 12 to do it because we were threatened with our food inventory and access, but nobody else was. And that was a big challenge. Yeah. But we feel pretty safe right now. All of the big manufacturers are heading towards that way and have succeeded. Like Lucky Charms now, the ones we'll be getting in next year has like spirulina in it for the green, turmeric, you know. I haven't tasted it, so I don't know what it's gonna taste like. And I haven't seen the final product. No, the mushy, yes. And expensive, yes. So then 50 Lucky Charms next year better built for this. With their whole milk. Yeah.
I don't want to continue now. I don't want you to talk this whole time. But the money thing keeps kind of coming up.
Yeah.
You mentioned budgets and whatnot.
Yeah.
So we obviously established things are going to get more expensive. Are the schools going to be getting higher reimbursements or are the reimbursements staying the same? And you just have to work around it.
So that comes out every year from the federal government and so my director, she was actually in Washington last week. They have a huge conference with the School Nutrition Association, it's a national association, and they go to the White House. She met with the state governor, something like that, Bill. Yes. Is that senator?
Senator.
Yes, I'm sorry. Your first face. She met with Bill and yeah. And really advocated for that increase of reimbursement. Like, I was speaking with Raylan last week. She was my intern, and the reimbursement right now is 40 cents a meal, and it costs nearly $5 to make a meal at this point. So, especially for CEP, I think it's only a little bit more, and those are our free meals, and then the state picks up the rest at a fixed rate. So, if we're serving meals, anything above that, that's fine. So yeah, it's a really big to do to balance everything out. And a really big advocacy right now in the nutrition space is to have that higher reimbursement because what comes with these DGAs are also scratch cooking. We're not popping in Pop-Tarts. I mean, I wouldn't recommend that anyways if you want the oatmeal in there, but other schools, that's their choice. So no Pop-Tarts probably, and they want fresh grits and biscuits every day. You know, that takes labor, that takes equipment, takes space, takes your schools to accommodate you to have a bigger breakfast, hot meal every single day. It gets really niche, and schools really need support.
Can I mention something else? Regarding budget and manufacturers. So another big thing in the legislative session last year was part of the bill was a requirement for manufacturers to have a QR code on their label if it contained one of these 50 plus products. And the label was a QR code that brought you to the FDA website. And the disclaimer on the QR code had to say, warning, this product contains something that can be harmful to your health. Follows it.
Banned in Europe
Yeah.
and like other countries. Yeah.
Well, I don't know, it was like 52 things.
Yeah.
That, like some of the things were already banned, so they wouldn't be in that product. So, but if you went scan the QR code, it brought you to the FDA website. The FDA, some of the products said it was good for you. So there's conflicting evidence right there. So those are the things we need to be thinking about, and those are the things that like we really need to be advocating for as nutrition professionals. Because I think they, I don't know, went to ChatGPT and got put up. They gave them a list. I'm not sure where they got that list from, but it's like, wait, this doesn't connect. But regarding the manufacturers, they were there because it's going to take like a completely like relabeling of their product, which costs a lot of money. Not only do they have to remanufacture their product, perhaps because it has one of these listed ingredients in it, but they also have to change their label, and like all those things cost a lot of money. And so I don't think, you know, the implications of how many people it affects, you know, not just dietitians who are educating the whole industry. It's really the whole industry that's affected on every, the whole food economy, really, yeah.
Did you think there will be changes within anything related to like tube feeds or any of those specialty products? Because those have very specialty ingredients in them that may become.
They're getting very organic
Yeah,
and expensive.
yeah,
Has there been any kind of whispering about that, or?
well, in our patient, we don't have one. So Catherine, I don't know if it's
Yeah.
a patient.
Well, I know like Abbott is
Yeah.
a main supplier of tube feed formulas and oral supplements like Ensure and Glucerna and things like that. And I know they are starting to put out like Glucerna strawberry with no added dyes. You know, they are starting to change their formula and then redo their labels to where they claim that there's no added dyes, there's no, you know, artificial sweeteners, although Glucerna does have artificial sweeteners for diabetics, but yeah, and then also we've been seeing on the inpatient side a bigger push towards organic tube feeding. And so we have more and more patients that are looking for like Cape Forms as an organic tube feeding. It has allergen free, but it's very, very expensive, like extremely expensive. Our average patient could not afford that, and most of them don't have insurance to begin with to even pay for it. So we have been seeing like more natural organic products come to our hospital, but then also patients requesting them. Yeah. Like tube feeding be like high protein. But it's good because it opens up like a conversation, because it's like, okay, you now feel like nutrition is important to you, so let's have that conversation. Yeah, it's a good thing, you know, that nutrition's part of a lot of people's conversation, whether it's controversial or not. You know, we're still talking about it, which is a good thing.
And from an educator standpoint, as far as talking about budgets and costs changes. So now that we have new dietary guidelines, that means all of our textbooks get updated. And we have textbook salespersons that will show up to our classes and wait for us outside. Heard that happen to a story the other day. And she liked them. And so they want us to buy into these $300 textbooks for the new graphics and the new info. And some people fall for that. Some schools, instructors that don't want to put in maybe don't have time. I would say like that. Don't have time to put in the extra work to make their own materials and need the textbook supplement slides and all that stuff. Will be like, hey, heck, it's not my money. It's $200 on the student. And so you're gonna see a whole new wave of new textbooks coming out that's gonna be a cost to our undergrads and our grad students. And that ripple effect goes through all the textbooks at some point, which they all get old eventually, but this is one of those things that causes everybody to stop and go, we need a new edition.
Right.
And it's like they just go into production right away with adding that information and going through that. So I would say, don't be surprised if one of our nutrition classes has to change it. I always try to keep it cheap, but kind of keeping with education tools, because you're with kids, you're educating college kids, but then you're with patients, We now don't have the MyPlate image to use, which was such a nice image to easily just show somebody. I should have brought one to show one. And we used to have with plastic ones at the Ag Center where someone can hold the plate and they can see where the dairy goes. That we do not have that now.
Right.
So what do y'all think your education would look like or is going to look like? Are you going to use the triangle? Or what are you going to use? What are you going to use? What's it going to look like?
Well, also to like add to that is with it being in the textbooks, like that's academic literature at that point. And these guidelines have been repealed. Like people in associations are repealing it. So it's like, are we going to actually take this, add scientific evidence base and academic literature? So those might even be adult in a couple of years. So
And then we get new textbooks and more money. And
right,
all
yeah.
the things.
Yeah, I mean, I'm sorry. Can you hear me? Oh, no. Okay, I was just gonna say, like, the, Academy of Nutrition and Dietetics and several organizations have come out with statements that, like, say that they really don't agree with these dietary guidelines. I mean, the Academy came out with it right away, they came out with the statement right away, but medical schools have come out, physician associations have really come out. Yeah, so it'll be really interesting to see, if anything,
that is even addressed.
But one of the other, like, going back to Dr. McKinley's question, how do we, like, educate now that we don't have my plate? 'Cause, yeah, my plate was great. Like, great. And I'm like, should I still use my plate? I don't know, it's so easy. But, yeah, it's like legal. I want to jail, but anyway, I think it's also important to keep in mind, and this is from an educator standpoint, because I'm not being, federally regulated to do anything, that we can teach you guys that there are other options out there to teach patients and clients. It's not just the dietary guidelines. That's not like the only thing that we can go by. There's several other organizations, reputable organizations that have recommendations on how to live a healthy lifestyle. Like, for example, the Harvard, I mentioned this earlier, I think the Harvard School of Public Health, like, just go to their website, Harvard School of Public Health. Their nutrition recommendations are very similar, if not the same, than the previous dietary guidelines. And they don't have my plate, but they have the healthy living plate. And it's very, very similar than to my plate, the healthy living plate. And so, like, okay, I can use the healthy living plate from Harvard as, a tool to educate patients, and I'm not using my plate. And then there's other organizations that have similar models of how you can build a healthy plate without using my plate.
Yeah, so I know at Veterans General, we have like a plate, it looks like a plate, but a little bit different. So we have to put vegetables, your proteins, fiber bars, fats, and bitter. So technically that's my plate, so I'm gonna still use that one. But definitely because it's, more detailed. Like we have any category, like the best options for each, with the pyramid.
Fiber.
Yeah, for sure. Yeah. But with the pyramid, it's like, here's just, pictures of different foods. I don't know how to explain that to patients, so.
Well, especially patients who are perhaps food insecure and can't afford the giant steak.
That's on there.
That's on there for dinner.
Right.
A realistic protein option for me as a food vegetarian.
Your fresh with each tallow.
I'm not sure. Because I'm not gonna find these out.
I can eat mayonnaise, it's fine. And just an FYI, since it's not illegal, you wouldn't be able to use it. Anybody who uses federal dollars has to follow federal guidelines, and
Yeah.
so they would have to prove that they're using whatever new educational tool
Yeah.
they've been guided to use. And so when this all happened, asked Ms. Barleycorn this, everyone from FNEP was standing outside her office while she was trying to work, freaking out, like, what do we do with all the My Plate stuff?
All of my plates.
Yeah, because
Yeah,
there's like
literally.
thousands of dollars in My Plate
Yeah.
stuff. But they're like, we need to figure out what we're going to do so we get in line, because they're gonna start asking us how we're teaching people, and we can no longer use these boxes of stuff anymore. And so it's like, that's the freak out from the federal folks, like that your ag center folks, where they're trying to figure out like, okay, we need to continue to get our federal dollars for our programs, and we need to follow what they're telling us, but we also need something that's easy to teach people. And so, are you going to give us something, or do we have to create something? So we're still in this limbo of
Yeah.
what is it gonna be, because there hasn't been something given to us.
Yeah.
And My Plate, didn't come out until 2010. So we had the dietary guidelines for quite some time. And then My Plate just showed up with the new ones in 2010. And there was that pushback then. And then people were like, oh wait, this is a great educational tool. So you never know, we might get something great that pops out of this. They're just not ready to. Oh, I saw that wince. Yeah, maybe something really good, it's just not ready for us yet. An opportunity to improve.
Yeah.
Do we have another audience question?
You answer. What am I?
It's for Sydney. So it sounds like you're not as regulated as they are, but are you seeing patients coming in now that this is no longer more of a professional tool? Now it is very out there in the consumer public world. Are you seeing patients coming in being like, wait, this is what I'm being told, and you're telling me something that may or may not be contradictory? Are you seeing more of that?
So not yet. So a lot of the patients I see, they have like very minimal education about nutrition, but I can see that happening for sure. And that's where it gets tricky because, then I'm like, yeah, I mean, how do you explain that? So that is like the challenge of trying to figure out, that, but so far,
Follow-up question to that.
Yeah.
Has Veterans General already done a prompt of hey, this is now this change, but with our patients, this is kind of how we're going to start educating them based on, yes, the guidelines, but what we have as protocol? Have there already been those discussions?
Right. Yeah. So the thing about the department I'm in, so it's 6 of us dietitians, so we can really create whatever we want, so we're pretty much in charge of the educational material. So, we're trying to implement both, to where it's practical for patients, for them to also understand. But yeah, as a whole, yeah, that has been a thing. But we're definitely aware of it, but it has not changed a whole lot yet.
Thank you.
We don't use the nutrition care manual outpatient. No, okay. Because the nutrition care manual is a huge manual of patient education handouts from the Academy of Nutrition and Dietetics. You need a subscription for it, and most hospitals and clinics have a subscription to the nutrition care manual. I haven't really seen any updates in the nutrition care manual, but I haven't, now that I'm thinking about it, I never really saw a My Plate thing in the nutrition care manual either.
There are links,
They are linked,
Mhm.
okay.
but I haven't seen that they.
Yeah, I'll have to go explore when I'm.
So disease.
It's very
Yeah.
specific, but there is a section on healthy living and just recommendations for each group. So yeah, I'm wondering if that's gonna get updated. I doubt it.
I doubt it. Like Academy feels so strongly, they'll probably keep.
No, I'll
Right.
buy on it.
Okay, so I'm gonna move to one last question for the panel. Since we have a lot of students, new RDs, about to be RDs, what skills do our younger generation need to navigate this policy to practice type of behavior. So we're seeing it right now with DGAs, but it's gonna be something else in the future. So what can they be doing now to kind of be building that muscle?
Yeah, I would say reading comprehension. If you're going to be in the political world or in any state or federal program, you know your program by reading their guidelines and then reading the bill fully to see if it will even affect you and how it will affect you, because sometimes politics can get really wordy. Like, for example, with the Whole Milk Act, they specifically said the National School Lunch Program, and I don't know if any school serves the National Breakfast Lunch Program outside of their National School Lunch Program in a different cafeteria. But right now, the nuance is that you won't be able to serve whole milk in your breakfast program, only your lunch program. So that is some really big pushback. So are you expecting directors to have their managers take out the whole milk at breakfast, put it out at lunch? What's that logistics gonna look like? Because that wording was left out of that policy. So that was caught by the SNA and directors all around the country, and that was from the advocacy last week at Washington. Right, so I would say really being able to understand what, again, like if you go into a program, how your program operates, the ins and outs of it, reading comprehension of the policies, but also just being able to share your knowledge humbly. You know, we are professionals. We've done the research. We've written about the research. We are living it day to day. But people like in counseling, they just don't know. So that's also policymakers. They just don't know. And you have to be able to communicate with that and communicate effectively and helpfully for them to actually listen.
Yeah, I'll definitely piggyback off what Kathy said. I mean, I was going to mention advocacy and oral communication. So those are two really important skills that students learn throughout their educational vocation. I think that's something that is really good at LSU. Actually, having gone through the undergraduate and the doctorate program, they really give students the tools to empower you guys to become advocates of the profession. I mean, you guys have really great role models from Dr. McKinley and Ms. Barleycorn. I mean, you guys are really being trained in a really good environment that promotes advocacy and induces crucial conversations like these. And so just like showing up today and being interested in this topic is showing me that you're interested in the profession, you want to learn about perhaps advocating for the profession, and just kind of keep in mind that just because you're a student doesn't mean that your voice isn't important. You know, your vocation is to become a dietitian, and if that's your vocation, then really advocacy should be part of that. And I think it starts when you're a student. I think one of our competencies actually is advocacy. It's certainly a competency in the graduate program. I think at the undergraduate program, advocacy is one of our competencies. But then, like Cassie said, like oral communication, it's really important to keep an open mind, and you want to hear the other side out. You know, you don't want to have a closed mind and say like, well, I'm right, you're wrong, and you don't know what you're talking about. But no, we want to have really open conversations, have really good communication skills, good listening skills to have those really important conversations with the other side to get them to understand where you're coming from a science professional.
Yeah, for counseling, I would say just being able to communicate with your patients, but also being able to just make practical suggestions for them, and kind of look at every patient as, an individual. Everything should be tailored to them. Everybody's different, really get their preferences, and then try to understand their story. So also when it comes to like changes in guidelines, just being able to adjust to them, the best you can, do a lot of research, and make the best judgment you can based off of that. But for sure, a lot of communication is helpful.
And for those that may not know, locally, we are right at the beginning of our Louisiana session. And so if you're curious to see if there's anything that's on the bill list that's related to what we're talking about as far as food additives, ingredients, all the things, that can be easily looked up on the websites. I don't know them off the top of my head, might have to Google it, but there may be something in there now that we have these TGA changes. Sometimes these things inspire those to slip stuff in now that it's on the topic.
Yeah.
That may be affecting these programs that we've been talking about. I'm just gonna give one last, any questions from the audience? All right, let's give our panel a round of applause. All right, so I want to thank everybody for coming this evening. I'm going to be sending out an evaluation to everybody because I want to know how we did and how we can improve. And then my registered dietitians in the room, I will be emailing you individually with your CEU certificate, so you have that.